Today we will talk about the obstructive airway, or what we call it choking. Obstructive airway, it can be two types. The first type, which is anatomical. In case of anatomical, it is due to mostly to head injury, so the tank will relax and the back of the tank, it will close the throat. The second thing, which is mechanical. Mechanical, it is mostly due to a piece of food in the throat, unsure piece of food that it will stuck when you try to swallow it. It block the airway, especially if it is allowed. How we, or it might be the danger, how we will avoid those conditions? It is always advisable when you are eating not to eat and talk or laugh during eating. For some of the children, they are taking their sandwiches and they are going for playing, and in this case, also when they are playing and eating and running, in this case, they might be prone to obstruction of the airway by the food that they are taking. It can be a piece of candy, it can be a piece of fruit inside the mouth. So avoid eating while you are running or playing or doing work. Avoid talking, avoid laughing during eating your meal. And chew the food properly. Don't swallow and chew the piece of meat, especially, because it might stuck in your throat, and in this case, you will be having choking. The type of choking also, it's two types. Either complete obstruction of the throat. In this case, the person, he will not be able to breathe or cough. Just you can see that he is clenching his neck like this. So this is the universal sign of airway obstruction. In case of partial obstruction, the client, he can cough, he can cough excessively, and trying to get that piece of food or that piece of that cause obstruction out, and he can also speak. So if you ask him, he can reply sometimes, but with difficulty. Anyway, in both cases, if he is still responsive, the first thing when we come to him in front of him, we will talk, are you choking? He will nod his head if it is a complete obstruction, so he will not be able to respond. Then you will introduce yourself. I am a trained first aider. Can I help you? He also will nod his head for accepting. I will tell someone to call the emergency, to activate the emergency people, call 999. Then I will come from the back of that person and put my hand on his abdomen, try to lean him down. Then I will do 5 slaps, back slap on his back. 1, 2, 3, 4, 5. Then I will do Hamlet maneuver. I will put my hand here, just below the sternum, and put the other hand over it. Then I will push up and in and up, in and up. 1, 2, 3, 4, 5. Then again 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Until the piece of food or the blooding thing that is coming out. If it is coming out, even though I have to transfer him to the hospital to see what's happened to him, he has to be examined by medical people there and to see if there is any effect of it in order to treat that. Are you okay? What's happening? Are you choking? Stand. Okay. So I will not stop unless another trained first aider or medical professional are coming and take over, or if that piece is coming out and the person start to breathe again, or if I'm exhausted and unable to do that, or if the person start to breathe normally, in this case I can stop. Or if he become unresponsive. If he become unresponsive, I will try to lean him down on a hard surface. Evaluate his breathing. See, tilt the head, lift the jaw. In this case, by that position, we try to open the airway. If the particle is obvious, I can swab it by my finger and take it out. If it is not obvious, I will give to breathe. Closing, pinch the nose. 1, 2. Then see if the person is having pulse or not. If no pulse is there, in this case I have to do also CPR. I put the palm of the hand at the middle of the sternum, put the other hand over it, keep my hand straight, move by my body, not by my hand, then compress. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then to breathe. I will continue with that until the person regains his consciousness, or another person is coming, another trained person is coming, or the medical people are coming to help and take over, or he become responsive and he start to breathe normally, or the object is coming out. In this case, if the object is coming out and he start to breathing, if he is still unconscious, I will put him in recovery position in one side. For the breathing, each breath that I give, it has to be for 2 seconds. So I will pinch the nose. This is for adult. For a child, 1.5 seconds. For the compression also, it has to be hard enough to let the chest move around 2 inches down. So like this. So this is how to deal with a case of choking. So the difference between CPR or cardiac arrest and choking, that in case of choking, we have to start with, if the patient is still conscious, we have to start with the back slap and Hamlet maneuver. Then when he becomes unresponsive, we have to put him, lean him down, start with breathing, check his pulse, then start with the CPR, and every 5 cycles we have to see if that object is becoming obvious. In this case, if it is obvious, I will swab it by my finger. If it is not obvious, I will not interfere. I will continue with 2 breaths and 30 compression. 2 breaths and 30 compression. I will not stop, as we said, until either another trained person is coming and he is taking over, or EAD machine is available, so I will apply it to analyze the condition and give the prompt for action. Or if I'm getting exhausted and I cannot continue, or if the scene is become unsafe. If the scene is become unsafe, also I have to try to take I have to try with emergency lift, so I have to take him out from that area. Thank you.